We haven't really changed that much. I think they've changed maybe one in the jail or something. Any questions pertaining to that? Okay. Move down to number 4, board appointments, proclamations. 4A is a proclamation, National Influenza Vaccination Week. That's something we've done, the last 5 years maybe, before, Don?
Yeah.
Everyone fine with that?
Yes.
All right. 4B, this is proclamation, GEMA's Winter Weather Preparedness Week. And now we've done that for a long time. Everybody fine with that? Mm-hmm. Okay. All right. 4C, this is a resolution Rdas 45-21, appointment of a member to the water and sewer. This is from the North Dade end. Lamar, have you got anything?
Yes, I've spoken with Alan Townsend and asked if he would serve, and I talked with you about it, and you thought it would be a good fit. He has agreed to serve, and I'd like to make that appointment for him to serve on the board.
Anybody got any questions on that? Okay. All right. Move down to 4D, resolution Rdas 47-21. This is appointment a member to the Industrial Development Authority. Larry Moore did submit a resignation letter, been a few weeks ago, and little Larry Moore, call him Little Larry Moore Jr., Larry Moore II, he has agreed to assume that position, and I think he'd be good. But if y'all got any other ideas, we can put it off for another, meeting. I mean, it's hard enough to get people.
I think a lot of him, he's good.
He's good, and he's,
I'm good with that.
Okay. Okay. I'm glad he did, because it's harder and harder to find people to serve on these boards, as y'all know.
And he's well qualified.
He is. Number 5, this is the lighting and at the sports complex, 5A. Philip, if you want to talk about that, or if that's something we've.
No, we talked about it earlier, and we're just going to table that for now.
Okay. Everybody fine with that?
Yeah, I just want to add to that with the splosh that, I would like to maybe do something to not put it in priority, but just make a list of what is out there, what we need to work on, what needs to get done, because there is quite a few things that are, on that level that needs to be worked on.
Yeah.
And I don't know if that would be in a special work session or.
Well, Don, and he can actually, because we've got certain things that's been voted on for years.
Yes.
And that's what you're really looking at, is look at the things that are on there that haven't been done. And then, but we can do that. We can compile, and then at our next meeting, we can go over, and do that.
Yeah. And I know some things are like, we might just need to get plans or just some type of a start of something, just look at that.
Yeah, okay. Good idea. Okay, let's move down to number 6. This is, we already pretty much discussed it, but anyway, this is pertaining to the Air Pack project. And Robin, I think, has made or sent us his decision. So there's really not anything to put on the consent agenda on this, right, Robin?
That's correct.
I mean, it's already, y'all already passed it. Okay. All right. And
Let's go back to that. You said
Yep.
number 6. What I'm reading is the life pack. Is that that's not, what I'm saying is not the air packs. Am I correct?
Are you signed in?
I am, I don't see it either.
I'm saying life pack,
Emergency services life pack, and then it goes to defibrillators.
defibrillators and that stuff.
That's the.
It's all under number A, I guess. Because it's got emergency services life pack on first line, then the next line says defibrillators and Lucas chest compression system device.
Okay.
what I've got 6C is under
Look
that.
at the agenda that's printed in front of you.
It says life pack, defibrillators, Lucas chest compression system devices, and Stryker Medical.
It's on 6C.
That's 6C is what 6C is. It's not saying nothing about air packs. I don't even see it.
Well, this is new though. This is something he's bringing to the table tonight.
That was from last month.
This is from last month here.
Okay,
Yeah, this here's something we're gonna talk about.
I got you, okay.
Yeah.
I don't see
No.
Yeah, 6A is the air packs, right?
Yes.
Oh, here it is on this this one that they printed.
That's what-
Yeah.
We see the one when you printed it up.
Okay, let's move down to 6B. This is the generator and switch for the Dade County Jail. This has been an ongoing thing. It's a lot of money, but it's been bid out. Alex, I'll let you turn it over to you on that.
Yep, we ended up having to cancel the RFP based on with our generator supplier and we had 2 electrical companies come in, and we need some more information from Georgia Power. The Justice Building is 1,000 amp transfer or transformer that's sitting out there inside the fenced area back behind the cooler and all that. The type of transfer switch to run the whole building will not fit in the mechanical room that we currently have, the odor switch. It has to be an outdoor complete transfer. So we just met with Georgia Power Tuesday, and they gave us the footage away from the existing transformer that we have to be, which is 12 foot. We've got the design on the transfer switch in that size, and we're going to make sure that it'll fit back there. And the plan is where the transformer is in the original line, we got to get located. It goes from that transformer underneath that parking lot pad and then comes into the corner of the Justice Building somewhere. And the plan is to get that and get it into that switch. So the engineer that's taking Carrie West's position is working with us and gave me some more numbers to call to work with our generator folks. Also, most of the 2 contractors that work with us, if they buy the generator, they're going to mark it up quite a bit, and the transfer switch. Our generator folks that give them the price recommended we done it like we should have probably bid it like we did with the water company, where we purchased the equipment direct as a government to save quite a bit of money. Just have that and have them install everything. So actually, one bidder said he couldn't do it, and the other bidder called and said the electrical company said he couldn't do it as neither. They had a emergency, and the other 2 that I thought was going to bid it said they couldn't. So really, we had nothing to turn in, so it was best to cancel, let us
Okay.
back up. And
We can go and get a price on the units itself.
well,
As far as the
we'll
product.
put another RFP out for the equipment only, and then we'll put another RFP out with what we want done with the type of switch gear that we need and where to come in, because knowing what size that line is and where the line lays, if we've got enough slack to get it out of the ground, push it over to the switch without having to redo it all the way into the
Yep.
thing. Plus, there'll be quite a bit of downtime on the Justice Building, and with the 93 inmates that Joseph Chambers had last month, we would need a temporary generator to run the facility while we're going. We can't risk that risk on the county. So working with whoever the generator supplier is, they will have to have a towable generator on site. Then we also have the contractor get that installed temporarily. We may have to go down for an hour,
Yeah.
get it turned back on and run on it as they're switching that. If we have to redig from the corner of the Justice Building, now we're trying to get it as close to the back corner right here as we can to save on money and use the existing wire. So we run into a few things to make it fair for everybody to bid. We're just going to have to redesign it a little bit. So
All right, that's good information. Maybe by January, we'll know something in February.
I hope so. We're trying.
While you're up there, go ahead and
Yep.
we'll move down to 6C and explain to the commissioners.
Yep, I guess with a few meetings I've been to as well with you and Don and our city clerk on this American Rescue Plan Act, there's still some things that we thought we could accomplish to assist our emergency services, our volunteer fire departments, our sheriff's office, if we'd have got the other 2 rounds of CARES last year. But one of the things that we were really looking at is these times of, as the sheriff talked about, the drugs and stuff, which we have, but we also have had a very hard increase of full arrests within our community. Even last month, before we got here to the commission, South Dade, Chief Matt Hill, Corey Castleberry, and Eddie Cagle sat there and worked the CPR along with me and another EMT that went down because we were so busy that day that we had to get there, and we didn't have some of this devices to provide good CPR. It was a witnessed arrest. The wife seen it, and it's just one of those things you wish you had this equipment there. We've got a mix of automatic external defibrillators that reshocks the patients. We've also have purchased some of those CPR machines that do good CPR with batteries. That's what the Lucas device is. And we'd like to put some of these out to all the volunteer fire departments. We need a couple more in EMS, that every vehicle that runs. That day when I left with that ambulance, there wasn't one on it because we only got 3. So we had to keep doing manual till the ambulance that was backing up Dade County from Memorial got here, which was a pretty long time, but you know, that's what we do. We just rotate out and do teamwork. We'd like to put the AEDs that we're looking at is to put AEDs in all 7 volunteer fire departments and the first out patrol units for the sheriff's departments because they are also trained in CPR. That's where the 21 LifePak 1000s, and this is a rugged case. The pre-connects for adults and for infants and child. And what's good about these, if the first responders or the sheriff's office is actually doing that, and when they get there, all they have to do is unplug their machine and plug it right into the Lucas, the LifePak system we have on the ambulances. They can continue to do the monitoring, the shocking, and pacing if they need to. The one we had the other day, last month, we had to rip those things on, put the new ones back on with a big LifePak, and that takes time. And time is life, and we like to stop that. We'd also like to update the defibrillators throughout our county administration public buildings. That's what those 10 LifePak CR2s are. We're looking at updating the admin building, the justice building, the courts facility, the 4-H building, the senior building, our transfer station, our Dade County shop, our sports complex, and the jail. And if the historical courthouse gets out, that would be the 10th building that we could put those in as well. And what's good about those is the Wi-Fi that we have throughout those buildings, it will talk back to us. It'll let us know if the battery's getting weak or if somebody touched it or opened it. And again, it's the same cord that could be plugged right into what Memorial EMS uses and what we have here for Dade EMS. We also, currently with our 4 ambulances, we only have 3 trucks that have the power load system and the power cots. This would be putting the 4th one in to have all 4 frontline trucks as they are moved in and out during maintenance and route breaks. Like we got one leaving tomorrow. It's going to be out a week to 2 weeks on a oil leak that our shop can't do that's going back to Ford. And 2 weeks prior to that, we had another one out 2 weeks when the turbo went out. And as we know, waiting on parts and getting in line with stuff is taking some time. The stair chair, these are the chairs that we use to take people in and out of the stairs and things. We need 2 more of those to get all the trucks equally so we don't have to move equipment around. Then the Lucas devices, there's 11 Lucas devices. That would be putting one in our Dade County jail, our 7 volunteer fire departments, and 2 more in EMS that we would be on every truck. And then the power supplies and the rechargeable. On the second page, you see that we have the Lucas, there's a Pro Care event and also preventive maintenance. We can get some of the LifePaks that are run out every day. We're going to put 5 of them on an annual where they come and check them and replace them, and batteries, anything's wrong. If it's messed up and they come and get it, they give us a replacement. That'll be on all the EMS trucks. Then the other ones that's out for the fire departments will be on it'll still be on an annual maintenance, but you got to think they're not being used as much as here as an ambulance that's going out every day. We just work with our sales rep, and that would be 1 year maintenance on all of those units. The AEDs, the plan that they talked to us about, they didn't really recommend it. We didn't want to feel like putting that in. The biggest thing that we could be worrying about would be a battery 4 or 5 years down the road. And if it gets bad, it will let us know. And then on the last 2 lines of maintenance, this is for the power load and the power stretcher. That would be adding 6 years of on-site repairs and replacement and fixes for both of those. And it comes with 1 year, adding the 6 years, so we'll have 7 years of maintenance on those stretchers and load system for the ambulance. So the total package of the equipment for that is $301,156, and the Pro Care maintenance for all the Lucases And the power load system is $75,030.55 for a grand total of $376,186.55 that we'd like to request the American Rescue Plan Act CARES funding to help with this for the EMS coverage and health care throughout our community.
If and, you know, we do, when, if we do approve this, whenever, but have you talked to them about this? I mean, that's $17,000, $18,000 just for maintenance. You know, have you talked to them about, you know, if you were to buy it?
We don't have to take the maintenance.
No, I
plan.
know that, but
Yeah.
I mean, you know, it's kind of like
Well, it's,
trading. I mean, you know, if we were to go and vote to do this, you'd think they would, that's almost what's
it's
$600?
$1,731 a year for 6 years. Those last two maintenance for the $10,299, that's 6 years of maintenance for the power load, and that's $1,731 a year. That's if it breaks, quits, or anything, they'll replace it within there, and then on the stretcher, it's $1,318 a year for 6 years.
Lamar, I'll just go down the line here.
But, I mean, we could, that last bet could be removed off it if we need to. It just means that we would have to pay for any maintenance and anything. Now, we do have these on our Life Pack 15. It does the 12 leads, the pacing and all that. That's a $35,000 piece of equipment that takes care of the hearts that we do put it.
Probably
And you
costs
have to have
more.
it.
Yeah,
And actually, like on the Lucas, one battery is $1,300 for the Lucas.
yeah.
We were looking at, and the maintenance plan is $1,671. So if a battery did go down, we'd have to order it, it's $1,300. So that's the way some of the companies do. They mark their equipment up to replacement equipment, and I hate it, but
Yeah.
now when we done the stretchers, I think, 3 or 4 years ago, we done a 6-year plan with them. The first two we
I
bought.
remember that.
And then when we done CARES funding in 20, I didn't add it to that one because we were so tight on funding, trying to get everything done. And we can do this again too, but again, that's covering the stretcher and the loader. And we can knock it down to 3 years or 2 years, it's just flexible. I just mimicked what we done the first time when we bought them.
Well, the stretchers, you know, because all of it's important. That stretchers is something that there's no one claim, one liability lawsuit from, you know, personnel would cover what one of these stretchers costs, because I know most of us have seen them. I mean, it takes the back strain out of
Yep.
the loading. I don't care, what's the weight limit on, what is it, up to what?
750 pounds.
Yeah, and you just, you know, roll them, as long as you can get them to the ambulance, it picks them, the people up and goes right in with them, but, Lamar, go ahead, let's just go down there.
What's the lifespan on these Lucas devices?
We've had some for 7, 8 years or more.
And are we not gonna get PMs on the life packs? They have to have some kind of service, or we did it at hospitals, the AEDs.
No, they don't. The other ones like you're talking about does. I have them on them already. The ones that's in the ambulances, we do have PMs on, but not the AEDs. It's not as important as the other
How
ones.
much does that cost a year to, because they have to be checked, I know.
Not
We had to
them.
check ours, I don't know about the new ones you may have.
Well, a AED and a full Life Pack 15 that we carry on the ambulances is like night and day. They're $35,000. That does the 12 leads and does all that. They have to be PM yearly for them to be maintained right. But AED, if it passes its self-check, it's just like the ones we have here in the building now. That between it checks fine, it's done. It's supposed to be done. But the PMs have to be done on not an AED that I know. You can get it, but it's about, I didn't even price it.
I know it's expensive, that's why I was asking. So I don't understand why there's like, some of these pro carriers, there's only 5, 6, and 1-in-1.
The 1-in-1 is for the power load and a power stretcher. One's for the load system, one's for the stretcher.
Okay, I'm okay with it.
6 of the Lucas devices, we have moved over to annual, that costs $420 a year, where they come in and PM them and it won't have battery replacements and stuff. 5 of the other units will have the full on-site preventive maintenance that's going to be on the EMS units, because they're used every day. They could be used more. So we're getting them where they do full replacement, suction cups, rechargeable battery replacement, and it equals up to $1,671 per unit versus $421. And we'll see where it says Pro Care Preventive Maintenance, the other one says Pro Care Preventive Service. That's the 2 different plans.
Yeah, that's where I'm messing. That's where I'm,
There's 2 different plans. One is full replacement, anything that breaks and takes care of it. That's only for 1 year.
until we get more information.
It's only 1 year. $1,671 per Lucas device.
So this total price at to the end is for 6-year total though, right?
Just the power stretcher and the power load is 6 years, where it says
So we're gonna be looking at this much money every year.
if we wanted to keep the maintenance on them. It's not that you have to have it. You don't have to have the Lucas's PM like you do. The only thing that we're regulated by the state and for other things is the Life Pack 15s that's on the ambulances, not the AEDs or the Lucases.
Having dealt with medical equipment and stuff, you'd be crazy not to have the preventative care on it, because
Well, that's another option if y'all want to do them. I'm
it's
just,
outrageous.
this stuff goes up 7%. This stuff goes up 7% January 1 too. They didn't go up in 20 and 21 due to COVID, and I've been trying to get in line to do this, and once we got the okay, I was just presenting it to you.
And I'm kind of like Melissa on the splosh. We kind of need to do the ARP. We need to line it out and see where there's so many.
Well, again, I attended several of the meetings as Don and Ted did, and your EMS response, this stuff covers it, and that's why we brought it to you. This is stuff that we were trying to do with CARES, but then when the state took the other 2 rounds of CARES from us, we had this in line. That was in line with what was preventing. And you look at emergency response care, just say if we had a full-time EMS, we could reimburse their pay back with some of this, but we don't have that. There's just certain things that it's allowed to, either the infrastructure or response and recovery, and this equals for the response. We're looking at response for the people that's sitting at home, not wanting to go to the hospital, that's getting sicker. It's a chance to use ARP money instead of splosh funds as a way could relieve some of that.
Bill, as of right now, we've only got, what, 1.5 on the ARP money?
1.3. Oh, yeah, it was 1.5. Yeah, you're right.
1.5, somewhere right around there.
It was $1.6.
I understand what you're saying on this, but at this time, I mean, my personal opinion is we just spent almost $500,000, and if we do this, you're getting almost 3/4 of them, 3/4 of what we've got so far. I know they're saying we're gonna get more, but we've not got it yet. So at this time, for me, I would want to table this and look at it a little more.
That's fine.
Ms. Rabbit?
Well, I mean, I'm that way too, but I feel like this is a time where the people need it. There are people sick. There are people, more than ever, there are people out
Yeah.
there that need this equipment.
It's hard to leave here, and we do it multiple times, even with the more ambulances we have, people's getting sicker longer. I'm still running out, getting on the truck day and night when we have to. It's just one of the things that these volunteers do.
Yeah,
It puts better equipment in their hands, but I understand it. It's,
it's, so I
the,
mean,
the regulation of the money is so tough. And I've asked this too, where are we going to speculate what's more important for this based on the regulations? So I'll be glad to be involved with that. Same thing with Splosh. We got things that are critically out of warranty and some 911 stuff that we need replaced. Our UPS system's been out of date. We're dragging it along, and our 16-year-old 911 phone systems has no more service life on it. We've actually have some equipment given to us by Whitfield that we've been robbing parts off of for the last few years. But that's some of the things I agree, since we're only getting funding in at a time, we need to prioritize some things.
yeah, I just feel like it's, more than ever, this is a time where these trucks need to be supplied with what they need. But it is a lot of money, so.
It is. I just why it be, but I understand.
Well, I don't, you know,
We just know
I
it's
understand where
going,
Philip's coming from as far, it'll be, because it is a lot. Need to talk about it a little bit. I mean, you know, one-on-one. But now this stretcher is something we've already gone through, and we see it is a win-win. There's no doubt about it in these ambulances. There's no doubt. And so, I mean, I don't have a problem with the stretcher. I don't, you know, I hate,
plus you're looking at all your public buildings to get them on one line of subjects that we can monitor and maintain and keep up.
But,
The same pads fit them for everything that we got. When one goes down, we just throw another one in.
Yeah.
That's why we like to get it all on the same sheet of music.
The other thing I say though, if you spend almost $400,000, looks to me like 6 years down the road, 7 years down the road, you're gonna be asking for another $400,000. Cause you just said you got 6 to 7 years out of this.
Well, yeah, but these go, I mean, the first ones we bought, the first Lucases, the life packs we bought were when Lifeguard started with us. They're still in service. That's almost 12 years. As long as they keep passing PMs, they have it. Now, the Lucases has been a fairly new device. The first one we bought we used with the trauma grant and Splosh. We bought the first one with we paid maybe a quarter of it with the trauma grant funds we got, and we used Splosh to the other, and it's still going. Maintenance and keeping them up and PM them like Lamar says, that's one thing we do. And when they come up, I mean, that could be a once a year thing. We could work in the budget if we have to. I hate to put it on
Me and Philip talked about this a long time ago. How do you decide if you adequately funded 911, emergency services? We got to talk, if it's your loved one laying there on the ground, are you gonna have a good, clean conscience that you did everything you could?
That's why we do what we do. It ain't that we're making a ton of money and putting the money in our pocket like some people think. We love our county. We love our citizens. I love doing what I do to help people. I put people sometime above my family, and my wife and kids will tell you that, and that's just a bad fault that I have. But and there's a lot of other people out here that do that. I'm just, I understand.
With everything we do,
Yep.
talk to somebody, everything we do, we have to weigh. We have to do some basic scale.
Some of the things you're not required to supply too, it's one of those
We
things.
gotta look at taxpayer. I mean, there's people out there that can barely afford their taxes now, and
Well, and it's one of those things too, if this is not decided on or discussed or taken care of, then we're just another month of making that decision again.
Yeah,
so.
and if we wait, we'll pay a 7% higher on equipment.
And
she
I
did
don't doubt
email.
it'll go even higher. I mean,
Yeah, I was speaking with one of the things, I can, I guess, flip a hat, but we were getting some equipment together on the storm shelters, and the guy that got the bid, the lowest price when we done the mini splits, he said that they're looking at a 10 to 20% increase January 1. So if we can, he's trying to double check the price, if we can lock it in, we purchase the mini splits now, we can save that on that grant funding. So it's a rough time for everybody. I think they've taken a hit these last 2 years, and
is 500,000 what we spent so far or put away on air packs? I was thinking it was more like 900,000.
Are you talking about the fire?
No,
the ARP money, American Rescue Plan Act.
That ARP money.
I can tell you what it is.
From last month.
Yeah,
Those air
it
packs.
was more than that, but they got a grant to go along with it.
yeah, it was more than that, but
I can look at the minutes and tell you exactly.
well, what we'll do, we can,
We'll
we'll
just-
call a vote and meeting,
Well, we ain't got to. We just table it and we just get the stuff together and see if we want to figure the PMs on all the AEDs, but that's 31 AEDs, or how many was it? 10 in the building and 21 out in the facilities. Yeah, between the EMS and patrol and the jail and the 10 public buildings, it'd be 31 AEDs. We could check and see what maintenance would be. And they could go longer, but it was getting over $500,000, so I had to start whittling it down. It's hard for me to try to put that. The 75,000 is just an option if we wanted it for maintenance. If not, we got to try to pick it up. And hope if it does break, don't fix it until it does break, or just pay the fee to get it fixed. That was only 75.
So if we don't vote on it, it's gonna go up about $25,000 on that bottom line, right?
Well, the 301, you just have to figure the 7% on the 301. They didn't say anything about the ProCare. The equipment's going up 7%. On the top of the second page, the equipment total.
Go up to 22,000 if you buy all of this.
Okay, you wanna go ahead and call a vote in the meeting? I mean, we just need to move on. I mean, this is a lot of money. I might, with Philip, like he said, I mean, that's gonna take, by the time you look at what we spent on the air packs and all that, and
And
plus
some
this,
other stuff that we've already spent.
that's gonna take, what, was it 3/4 of what we got?
Well, currently in the bank. right?
That's what I mean, as far as.
But there is a thought out there, and we've been told,
Yeah, I
you
know.
don't spend it, you may not get the second part. Now, I don't know how they're gonna know.
And I hate to say that, we met with engineers on the sewer plant today. We're fixing to pull the trigger on a big project because we're worried about that for the reporting.
Let's just vote on it, and maybe, I mean,
I'm not sure what I wanna do.
well, we'll vote you can vote to table it then.
Give you a little more time to think.
That's right. I mean, this is a lot to think about. This is not, $200,000-$300,000.
And we really have just got this. I've only had this for
Yeah.
2 days.
The
so-
the
Me
total
too.
cost for the airport,
The total cost for the air packs, total was $668,778. The city, I think, has committed, what, 85,000 or so, a little bit of change. And then our portion is $467,446.
Because the city owns equipment.
And then this will
Yeah,
be
yeah.
Carry the city equipment along with.
almost 400,000.
Yeah.
Right.
800,000.
But so, anyway,
Over a million.
That'll leave us about, what would leave us with about,
600,000 or 700,000, but we've done spent more than that. Some other stuff coming out of that ARP money as well.
well, the coroner's van's been paid out of that.
I don't remember what else.
see, that's where I'm at with Melissa. though.
Small things.
We don't have a
PPE,
needs that we know.
Right.
some
I went for
PPE,
Robert, I'm
some,
not first time with Full House and catch.
what was that, gloves for the jail. It's just so far minor stuff, really.
And how do we know that we're not going over that?
How do we want?
Do we have a list of, so we're not going over that amount, or?
Yeah, that's what we do.
Right now, we're not went over.
We won't let it go over.
Over 3/4 spent.
Yeah.
You're good.
Probably it.
And some of the fire, Alex, I'm sorry to keep bothering you,
Over
but some of
half.
the fire departments up in North Dade told me today, Stacy was with me, we were down there working today. They don't have an AED. Is that true?
I don't know about them. I know that the two that we have in Trenton are getting out of date. We can't get the AED pass for them. We've had them 15 or 20 years. New Salem bought one of these, on their own funding of SPOS or something last time, a couple of years, maybe a year or so ago. It's like anything, and I hate to see, and Philip's right, every 6 or 7 years, I'm gonna be coming asking you for servers and computers, and Microsoft's got us in a thing. It's kind of some of this stuff too.
But that's,
I think, I hate to say, but I think Matt Hill was trying to get one through the firehouse grant or something. He's got an older one as well too, that was originally been out since the mid-90s when I was in EMT school. There was a grant to come out and put a bunch over here in Dade County. New Salem had one. I want to say South Dade maybe had one. They were really big, life pack. They was as big as this table or bigger. I remember training on them in EMT school and they went out and they had plaques on them.
The last ones North Dade said they got was donated by Memorial, I think.
Might have been.
Either-
Yeah, they're very expensive items and,
It's-
yeah, it's been harder with the ones, getting the,
And the AEDs and the Lucas, they work hand in hand, right?
well, the Lucas gives the good CPR, constant CPR, good depth compressions. Humans wear out quick giving CPR. Your back, your muscles, and you're not going in good to do the chest compression because you have to break the sternum and break the ribs and get in there. This machine, you set it between the chest line, you push it down to them, hit a button, and it takes off.
You strap it around them.
No, it's got a board that goes behind the back. It clicks on, you adjust the paddle down. It's a big cup about this big, and you hit a button, and it just takes off. And it talks to when the ambulance gets there, the newer ones talk to the LifePack 15, and it can see how many compressions it's done, how long it's gone. pretty neat that they can take that data and give it to the doctor and never give it online. But, there's still the old-fashioned way we always do, and that's what, got us when Mr. Hannah passed away last month. I think Matt got there, started CPR. Corey got there with the AED. He started CPR. Eddie got there. Then we got there behind the ambulance, and I think we went through 3 or 4 rounds of everybody taking turns breathing and CPRing to get them going while Matt started IVs and stuff. Because when we got there with the ambulance, Matt's an advanced EMT. He put an airway in, got the IVs going. It's way before the ambulance ever got there. This is what we strive to do to help people quick while ambulances are getting there.
Okay. What do you want to do? You want
I say take it and vote.
to, all right, we'll just vote on it. We got one, me, that's good. All right. Let's move down to, the, number 7, resolution R-46-21, public transportation, GDOT zero tolerance drug policy. Pretty well self-explanatory there. Anybody got any problems with that? Put that on the consent agenda. All right. And this other, it's been tabled anyway on the lighting. Okay. We got, you want to talk in a work session? You want to come up? Or you want to do it in there? Okay. Just come up and tell us, who you represent and, everybody out.
All right. So I have not actually gotten to attend one of these meetings before, but I'm Chelsea Kovalevsky. I'm your assistant director for the library system. And you guys know that we have been looking high and low for a wonderful manager for our Dade County branch, and Mindy Hayworth is who was hired. And so I'm just going to let her say a few words. But Mindy?
So she's our new manager of the Dade County Library. Okay.
Yes, sir. I will start training on Monday, and then I will start in the library the following Monday, Tuesday. Right.
Okay.
And I'm Mindy Howarth. I live in Walker County in Flintstone. We moved here in 2006. I've been an ELA teacher for the past couple years. I'm a mom of 4 grown homeschool kids, and books and literacy are my passion in my life. I love it. I'm so excited. I cannot wait to make this next transition, get to know more about the community. I've been doing some research online, looking up several of your surveys that y'all took to try to figure out what's important to the community and the role that the library plays in this community. And I've only heard amazing things about the libraries.
Where are you from? Where you live? You live in Dade or you?
I live in Walker.
In Walker?
I live in Walker, yeah. I live in Flintstone, right at the bottom of the mountain. Right at the bottom of
Let's
Nicky
see, that's
Road.
minus 20 points right there.
I know. Exactly.
We're glad to have you now.
Thank you so much. I
I think you'll
appreciate
be
it.
wanting to move here before about a year once you live, once you work over here.
Well, I'm an avid trail runner, and I'm in Dade County almost, 3-4 times a week running on the trails up in here. So
Really? Okay.
yeah.
Yeah.
You got some
thank
big
you.
shoes to fill.
What's that?
You got some big shoes to fill.
I know. I've heard, and on the day that I interviewed, I was walking over and I was told that this little branch was voted the 3rd best small library branch in the country in 2018, and I didn't know that. I've just amazing things. I said I feel like I stepped into this little gold mine.
Yeah.
So I'm incredibly excited. I'm honored to have been selected.
Yep. You'll like it. You'll like it.
Thank you.
All right. Appreciate it.
All right.
Call any of us. You need us. Okay.
Thank you.
All right. Anybody want to add anything before we go into our meeting? Okay, if not, I'll go ahead and adjourn the work session. And y'all need to take a break or anything. If not, we'll go right into our meeting. You do?
Just a short break.
All right. Yeah, let's take about 5 minutes.
Hallworth or Hanford? Hall.